Assalamualaikum and good evening to my fellow friends and Dr. Izan. My name is Nur Nasaiwani binti Humaidrus. My matrix number is 216411. Today I will be talking about the episode of pain. Okay, these are the table content of my speech. It have introduction, 3 main points and a conclusion. Now, I would like to highlight the main point of my presentation, which are the definition of CIPA, differences between CIPA and CRPS, and the last one is effect of a painless lifestyle. Okay, the purpose of my speech today is to inform everyone here about the awareness of CIPA disease. Now, I'm going to talk about CIPA. You all must wonder, what is correlation between CIPA and the absence of pain, right? If you want to know, stay tuned, okay? But before that, I need help from all of you to pinch your hands like this. Like this. Okay, did you feel any pain or temperature? If you do, congratulations because you are free from CIPA disease. Okay, I will continue to the definition of CIPA. What is CIPA? CIPA is short term of congenital insensitivity to pain with anhidrosis. CIPA was first reported in 1932 by a New York physician called George Dearborn, who described the case of 54 years old ticket salesman who claimed not to recall any pain despite a range of experiences such as being impaled by a lengthy hatchet as a child and subsequently running home. Okay, people with CIPA cannot feel pain. CIPA has two characteristic features, which is the inability to feel pain and temperature, and decrease or absent sweating called anhidrosis. This condition is also known as hereditary sensory or an autonomic neuropathy type 5. Okay. CIPA is a very rare and extremely dangerous condition. The incidence of this disorder is about only 1 in 125 million, with a few cases reported worldwide to date. So this is the latest statistic that I found. Like I said, these diseases are rare, so it's kind of hard to find a statistic for this disease. Okay, so this is a statistic from China. With 41 cases were reported in year 2019. Okay, a picture A show age profile of the patient. The data are expressed as a percentage. Okay, we can see here 7% patient are from age 2 and below, and 22% are from age 6 and below, and 71% from age 2 till 6. Okay, now we move to picture B. Picture B show the gender profile of the patient. The gender distribution of the patient was 30 for male and 11 for female. Okay, now we move to causes of CIPA. Okay, causes of CIPA is inherited in an autosomal recessive pattern and mutation in NRTK1 gene. Okay, this condition is inherited in autosomal recessive pattern, which means both copies of the gene in each cell have mutation. The parent of an individual with an autosomal recessive condition each carry one copy of mutated gene, but they typically do not show signs and symptoms of the condition. Mutation in RTK1 gene cause CIPA. The NRTK1 gene provides instruction for making a receptor protein that bind to another protein called NGF-beta. The NRTK1 receptor is important for the survival of nerve cell. The NRTK1 receptor is found on the surface of cell, particularly neuron that transmit pain, temperature, and sensory neuron. When the NGF-beta protein bind to the NRTK1 receptor, signals are transmitted inside the cell that tell the cell to grow and divide, that help it survive. Mutation in the NRTK1 gene lead to a protein that cannot transmit signal. Without the proper signaling, neuron die by a process of self-destruction called apoptosis. Loss of sensory neuron leads to the inability to feel pain in people with CIPA. In addition, people with CIPA lost the nerve leading to their sweat gland, which causes the anhidrosis seen in the affected individual. Pain sensing nerve in this patient are not properly connected in part of the brain that receive the pain message. CIPA is extremely dangerous and in most cases the patient doesn't live over the age of 25. Although some of them can live a fairly normal life, they must constantly check for cuts, bruises, self-mutilation and other possible unfelt injuries. Self-mutilation is almost invariable feature of this disorder, most often involving the teeth, lips, tongue, ear, eyes, nose, and finger. Okay, I want to show you guys a video, but before that, I want to warn all of you that this video might trigger some people. Okay, I will start, okay?
응급실은 1층이에요. 여기는 통수희 학생 됐지. 가자.
Pusat pengendali rasa sakit dikejutkan oleh seorang remaja yang datang bersama ibunya, di mana anak itu datang dalam kondisi tangan tertusuk dan darah yang bercucuran. Anehnya anak ini tidak menunjukkan rasa sakit sama sekali. Bahkan ia meminta ibunya untuk pulang. Untuk memastikan diagnosa, Dr. Cha menekan luka anak itu dan benar dia tidak menunjukkan reaksi apapun. Anak ini dijahit tanpa menggunakan bius. Anak ini juga tidak akan merasakan apa-apa jika tulangnya patah atau organnya rusak. Dr. Cha mendiagnosa dengan penyakit CIPA, di mana pasien mengalami ketidaksensitifan terhadap rasa sakit atau suhu. Mereka menstimulus lychee shock dengan suhu dingin dan panas dan memberikan latihan kognitif. Tetapi otaknya tidak bisa menerima sinyal meski tubuh distimulus. Jadi para dokter memberitahunya bahwa yang para dokter lakukan seharusnya sakit.
Okay, this video is a clip from Korean drama named Dr. John. From the video, you can see how people with CIPA will react to pain. That is why most of people who had CIPA cannot survive until age 25. Now, I will go to the symptom of CIPA. Most people with congenital insensitivity to pain will show the following symptom. Pain insensitivity, where there's no reaction to painful sensation caused by cuts, burn, injection, and so on. Okay, next is repeated severe injuries and accidental self-injury, like severe bite wound on the tongue, mouth, and fingers. Anhidrosis, which is the reduced ability to sweat, and anosmia. After that, no reaction to extreme temperature, recurrent high fever, lack of corneal reflex, like which is when you blink as a reflex to something touching your cornea. And the last one is intellectual disability. Okay, how to diagnose CIPA? CIPA is often diagnosed in early childhood due to the lack of typical pain response, like wincing or crying during standard medical procedure like vaccination and treatment for common childhood injuries like fall. Accidental self-injury is common among young children with CIPA. This includes aggressively beating their mouth, tongue, and fingers to the point of causing severe damage. A doctor will diagnose congenital insensitivity to pain by testing a baby's pain response to pricking with something that typically causes pain but doesn't causes damage or scarring, like a needle. But for other individuals, an evaluation is required if they continue to have traumatic injuries. To confirm the result of this test, a doctor may recommend to do a genetic testing because CIPA is very rare but can cause severe accidental injuries. A child with congenital insensitivity to pain may initially be mistakenly regarded as a victim of child abuse. Okay, for us, all diseases have treatment, right? But since CIPA is a genetic condition, there has been no cure discovered yet, which means patients and their families will need to learn how to manage this condition. Same goes to others genetic condition disease like syndrome Down, Cradusha, and so on. Okay, these are some common tips that can help CIPA patients manage their condition include the following. Childhood proofing. The patient's home is important in avoiding injuries. Wearing protective gear like protective eyewear helps to prevent self-injuries. Teaching patients to seek medical help when they see blood or injuries. Physical therapy is helpful, especially in dealing with joint deterioration. And the last one is moving and living in a cooler climate can help a CIPA patient avoid overheating. The people who are suffering from CIPA needs to be watched closely as they could end up burning or hurting themselves without feeling any pain. People with CIPA may end up fracturing their arms or leg and not even notice it due to the lack of pain. Another risk that face people with CIPA is joint deterioration. People may tend to exert themselves unnecessarily or strain certain joints for an extended period of time without noticing it. Patients who are suffering from CIPA also run the risk of overheating. Sweating helps regulate body temperature, hence the lack of sweating can lead to the sudden fever, febrile seizures, and even fatalities. Okay, just now I was talking about CIPA, which is congenital insensitivity to pain. I'm sure all of you must wondering, is there any contra disease to CIPA? Are you all wondering? Okay, the answer is yes. There are a disease that contra to CIPA, which is called CRPS. CRPS is the short form for complex regional pain syndrome. Some people call the CRPS as a new four-letter word from hell because the pain of this disease sometimes is very unbearable. We are all aware that CIPA is the opposite of CRPS and vice versa. A CIPA patient doesn't feel pain, neither does they feel temperature, while a CRPS patient feel pain excessively even if one blows toward them directly. CRPS is a broad term to describe excess and prolonged pain and inflammation that follows an injury to an arm or leg. CRPS is poorly understood condition where a person experiences persistent severe and debilitating pain. Although most cases of CRPS are triggered by an injury, the resulting pain is much more severe and long-lasting than normal. The pain usually only affects one limb, but it can sometimes spread to another part of the body. The skin of the affected body part can become so sensitive that a slight touch, bump, or even a change in temperature can cause intense pain. Affected areas can also become swollen, stiff, or undergo fluctuating change in color or temperature. Uh, CRPS often gradually improve over time, but some people with CRPS experience pain for many years. Okay, now I will share the differences symptom of CIPA and CRPS patient. I will start with CRPS first. People who had CRPS commonly felt intense, burning, and throbbing pain, usually in the arm and leg. Sensitivity to touch occur, swelling of the painful area, change in the skin temperature and colors, change in skin texture, abnormal growth of sweating, nail and hair, joint stiffness, swelling and damage, muscle spasm, tremor, weakness, and loss caused by injury or lack of use. Decreased ability to move the affected body part due to the pain arising from it. And while CIPA patient had no ability to produce sweat, inability to regulate their own body temperature, inability to feel pain and temperature, bone problem and joint problem due to the repeated injuries. The body of Homo sapien is programmed to respond to external stimuli. depend on the force exerted on such a human as well as the strength he had. If there is a change in the expected outcome of the response to external stimulus, there is an uh, there is an abnormality, otherwise known as illness. Part of those illness that come as result of not feeling pain or feeling excessive pain is CIPA and CRPS respectively. Be it illness that involve pain or not, both lead to the death if not properly taken care of it. CRPS involve pain while CIPA comes with no pain at all. Okay, now we'll continue to the difference between CIPA and CRPS causes. Okay, CIPA is caused by genetic mutation, while CRPS occur after distinct nerve injury or after illness or injury. Okay, I think some people might wonder why this disease is a big matter, because to those of us who felt pain every day, the notion of painless existence perhaps initially appealing. Scrapes, bruises, and burn would still be present on our bodies, but would not feel any differently from the rest of our body, while the pain-free life might seem like a pleasant way to life. CIPA is very harmful condition which often shorten the lifespan of people who have it, because people with CIPA cannot be taught that harming the body is a bad thing, since they never uh, feel the consequences. Example, normal children learn to associate negative consequences with the bad action through experience, most often involving pain. The children then know that taking the action again would cause them to further pain, and so they do not repeat it. For instance, if a child jumps off a tree, a painful landing will reinforce a hesitancy to do so in the future. Other than that, people with CIPA can never learn lesson about doing dangerous things. These people will jump out of the tree, experience no pain, and more likely to repeat that action. They can even sustain multiple fracture bone injuries. Children with CIPA often know on their Children with CIPA often know on their fingers to the point where it can endanger their life because they don't understand that damaging the fingers is harmful. The lips and tongue are other common target for the children with CIPA. Most children afflicted with the disorder do not live past age 3, though not all deaths are due to the lack of pain. In fact, half of CIPA deaths are due to the overheating because the person's inability to produce sweat. This causes hypothermia or extremely elevated body temperature, which lead which then lead to death. Excessive self-mutilation can also lead to death in some cases. There have been an extremely small number of CIPA patients who live past age 25. So, people with CIPA need to routinely examine themselves to check for injuries that they haven't noticed. The high likelihood that accidental injury and poor wound healing can reduce their life expectancy. Okay, talk about this. I remember that I used to read some confession from CIPA patient according to their absence of pain lifestyle. So I want to share a story about Ashley Blocker, 16 years old girl from Peterson, Georgia, who has been completely unable to sense any kind of physical pain since the day she was born. As a newborn baby, she barely made a sound, and when her milk teeth start coming out, she nearly chewed off part of her tongue. Growing up, she burned the skin of her palm of her hand and on a pressure washer that her father had left running, and once ran around on a broken leg for 2 whole days before her parents noticed the injury. She was once warmed and beaten by hundreds of fire and has dipped her hand into boiling water and injured herself in countless other ways without ever feeling a thing. Then after that, she was diagnosed to have CIPA disease. Okay, why we need pain? Pain is as essential to our life as breathing and walking. It is part of who we are and is among the most essential thing we need to survive. Pain acts as warning system for our body, alerting you to illnesses and injuries. The instinct to avoid pain also keep you from taking part in dangerous activity. If you cannot feel the pain, any pain, you may not notice a severe injury, or you may seriously hurt yourself by accidents. For example, you may place your hand on a stove burner. Without pain, you don't have the natural instinct to protect one from being bumped or scraped. And this can lead to the worsening of your injuries and infection. People don't come with the warning light, like the light on the car dashboard that let the driver know when the car is low on oil or gas. We need to sensation of pain to let us know when our bodies need extra care. It is an important signal. When we sense the pain, we pay attention to our bodies and can take steps to fix what hurt. Pain also may prevent us from injuring a body part even more. If it didn't hurt to walk on a broken leg, a person might keep using it and cause more damage. If your throat is really sore, you will probably to go to the doctor who can treat the infection if you have one. Okay, the doctor and other health professionals use a person's pain as a clue in figuring out what is wrong. The first question you will probably be asked is, how much pain do you have, or how much does this hurt? Often, a nurse will show you some pictures of face with smile or tears so that you can choose the one that match your how you feel. This help your doctor or nurse know how much you hurt. But it will be hard for a CIPA patient. For example, medical emergencies that would usually cause you to seek medical help because of pain, like appendix or heart attack, it can go completely unnoticed by someone with CIPA. So, they may not notice if they have fractures, dislocation, and joint damage. This can gradually cause long-term deformity and disability. In conclusion, it is important for us to know what CIPA disease is, like the definition of CIPA, the differences between CIPA and CRPS, and the effect of a painless lifestyle. So I hope that my sharing today can help you all know more about this disease, because even though this disease is rare, the possibility to get it still exists. Also, it can be our precious person who had this disease without their realization. So, I also hope that my sharing about CIPA can make us aware about people around us who are experiencing the absence of pain. Because many people are still strange with this disease and take it lightly, even though it can be fatal. So now you guys know what is the correlation between CIPA and the absence of pain. The people who had CIPA disease will live their life with the absence of pain. Okay, this is the references that I used to do this speech. Thank you.